streaming panel discussion. Welcome to the second live panel discussion of Birthright, A War Stories Impact Campaign. I wanted to invite people to discuss the topic of reproductive justice in the larger framework of birthing and reproductive rights. We never set out to do a film about abortion. We always wanted to do a film about the fallout and collateral damage that occurs when women's bodily autonomy and medical decision-making is intruded upon by government and religious forces. What we are seeing today and what we show in the film is how the repressive reproductive restrictions that have come across the country through state legislatures on a grassroots basis and are now being handed down through the Trump administration are creating a public health crisis and a humanitarian crisis. There is a direct correlation between reproductive restrictions and maternal mortality. This is not a discussion about choice. This is a discussion about access to medical care, access to one's own right to determine whether or not to give birth, and then the right to decide to raise children in an economically sustainable, safe environment. So today we are joined by three people who are experts in this field. First, I'd like to introduce Nadia Hussain, who is the Maternal Justice Campaign Director for the organization MomsRising, a 10-year-old activist organization with more than 1 million members that is committed to advocating for all of the issues that affect women, mothers, and families. Issues such as economic parity, paid sick leave, paid vacation time, gun safety, immigration reform, and many others. So welcome, Nadia.
Thank you so much.
And we have with us Indra Lusero. Indra is a reproductive rights attorney. She is on the staff of National Advocates for Pregnant Women, and she is the founder of both the Birthrights Bar and a group called Elephant Circle, which supports the decisions and choices and advocates on behalf of pregnant women and birthing rights. So welcome to you, Indra.
Thank you. And just FYI, I prefer the pronouns they and them.
Pardon? Okay. Okay. We also hope to be joined by Patrisse Cullors, the longtime activist and co-founder of Black Lives Matter. Unfortunately, she is suffering from strep throat and has graciously agreed to try to join us on audio as long as she can. So Patrisse, if you're there, I'd like to welcome you. Patrisse is committed to social justice, to prison reform, and to protecting the safety and the rights of all people, but particularly against criminal justice abuse.
Hi, thanks for having me.
We hope your voice holds out.
I hope so too.
So I'd like to begin by asking the question, and let me ask you, Nadia, how does reproductive justice fit into the paradigm of maternal space? How does reproductive justice, people tend to think of it in terms of abortion rights. How do we define it and understand it in the broader context of women, families, and birthing?
When I think of reproductive justice or maternal justice, or when you look at maternal health, it's a continuum. These aren't siloed aspects of a woman's health experience, right? So when anybody talks about reproductive justice or maternal justice or reproductive health or maternal health, in the end, it's really health. It's about women's health. So they're not just connected. I mean, they're just different points in the process of a woman's health. For example, in the United States, 60% of maternal deaths would be prevented with just better access to quality healthcare. And that means healthcare before a woman even gets pregnant or chooses to get pregnant. It means good health during a pregnancy. It means having access to healthcare after a pregnancy. And such a big part of it is access to preventative health. A healthy woman is more likely to have a healthy birth outcome. And reproductive choices, reproductive access to reproductive health is integral to ensuring that we do have positive maternal health outcomes.
And unfortunately, in the United States, we now rank 47th in terms of maternal mortality, and women of color are 3 to 4 times more likely to suffer as a result, to die as a result of the lack of access to healthcare. And not only a lack of access, but as we have heard over and over again, stories about women whose doctors do not listen to them, whose complaints are ignored, and who are basically receiving secondary medical care. Patrisse, can you talk a bit about that?
Definitely. I think what Nadia talked about around what kind of healthcare women and people receive before they get pregnant is absolutely critical. And if we're looking at Black women and our maternal health outcomes, they're more likely to be grave or very serious. And my own birth experience, I had 2 midwives looking forward to having a home birth. I couldn't have a home birth, went to the hospital, and pretty much everything spiraled from there. It was the hospital experience, specifically with my doctor, who was an older white male, who did not prep me for my C-section, gave me no information about it, gave me little care postpartum. I ended up getting a pneumonia. There was a blood clot scare in my postpartum. And then we could look at Serena Williams, who in some ways we could, see her as royalty, and yet she had to fight for her own life postpartum. And this is the issue that I've heard from Black women across the country over and over again. The terrible experiences inside a hospital, and then postpartum, if they survive that experience of birthing, the postpartum being humiliating and lacking dignity. And I think we have to really have a conversation about the lack of policies that exist in the United States that keep women and people from dying while giving birth or postpartum. And we have to talk about the healthcare professionals and implicit bias and how that impacts women and people's ability to have healthy birth outcomes.
I think it's not only the bias, but it's, as I said earlier, class warfare, because women who are on Medicaid tend to have substandard care in many cases, have more forced C-sections, because the reality is that the reimbursement for a C-section is higher than for a natural childbirth. And that is something that also contributes to the tragic statistics in terms of women's health. Indra, can you talk about some of that address some of these issues in terms of birthing rights?
Well, the first thing I want to note actually is that while class is certainly a part of the dynamics at play here, it also isn't the cause of the disparities across race when it comes to outcomes like maternal mortality and other birth outcomes that have disparities based on race. Those are not the result of poverty. One of the most interesting things about those statistics, which just indicate that Black infants have a higher rate of preterm birth and a higher rate of low birth weight and very low birth weight, even accounting for parents who are wealthy. And Black women have a higher rate of dying after childbirth, even when they're wealthy and highly educated. So one of the things that I think is particularly notable about what's happening in America with regard to maternity care is that it can't only be blamed on poverty. Now, many things, though, can be blamed on poverty. One of the issues that I deal with is the child welfare system, which is often used as a coercive threat when people are getting maternity care and during their experience of giving birth, and or it is made good on, and people are investigated and have state interactions because of a healthcare provider reporting them to child welfare. And those rates are higher for lower income families. They're also higher for families of color, those kinds of interventions and investigations by the state. So one of the interesting things about this issue is the ways that poverty does play a role and then the places where it doesn't play a role. And the fact that folks from across socioeconomic backgrounds may experience criminalization as a result of their pregnancy and may experience a lack of control in their care. So I think at core, it's the issue of the state wanting to control the bodies of pregnant people.
Well, and part of that also is an attempt to build up a body of jurisprudence that establishes a personhood for the fetus. And so that's why you have this policing of the womb and monitoring and challenging the behavior of pregnant women under the guise of child abuse and fetal abuse and fetal protection laws, so that the criminalization of activity is being used for another agenda here. Does anyone want to chime in on that? Nadia?
Actually, I was wondering if Indra could talk a little bit more about that, because I feel like she's covered a little bit more deeply into it.
So it's definitely true that what we're seeing across the country are laws that were not advertised as being about control of pregnant people are nonetheless being used to control pregnant people. One great example is Wisconsin's law, which is their, it's their Unborn Child Protection Act. And while this was passed many years ago, it's only recently been challenged constitutionally. And it was challenged by Tammy Lacher, who went in to get prenatal care when she was early in her pregnancy and disclosed to her prenatal provider that she had, before she knew she was pregnant, she had used meth and marijuana, and she wanted help to make sure that she had a good, healthy pregnancy. And instead what she got through this law, the state intervening in her prenatal care and in fact requiring that she go get residential substance abuse treatment. And at this point, she had not even been diagnosed as having a substance abuse disorder. So she refused to go to this residential treatment facility, which, by the way, didn't have prenatal care. And as a result of her refusal, she was sent to jail. Again, to a place, a jail, where they didn't have prenatal care. So that law, of course, was advertised as something that would help unborn children, but as it's being enacted is certainly not, is actually harming both pregnant people and the fetuses that they carry. And part of the logic, as you suggest, of those laws is that we've come to understand that there's an entity that may be worthy of rights during pregnancy. And the problem with that concept is it doesn't make sense logically. You can't really have a person who's in utero be in conflict with the gestating person. It's hard to really actualize that. And the way that you have to actualize it is to take control of that pregnant person's body, whether that be by forcing them to have a C-section, forcing them to residential treatment, or criminalizing them.
And what we have seen, in addition to the criminal charges against someone like Tammy, what we have seen in other cases, there was a case in Florida where a woman had a court-ordered hospital bed rest where she was locked in a hospital room because she had young toddlers and was not able to stay off her feet, so the court ordered it. There was a case in Pennsylvania where a woman was carrying a fetus that was guesstimated to weigh about 10 pounds, and the hospital went to court to get guardianship of this unborn fetus in order to perform a C-section. She and her husband fled the state. She gave birth naturally to a 10-pound baby. But this is the kind of state and court interference we're having now, which is beginning to feel a lot like the real-life Handmaid's Tale and moving toward Gilead. Patrisse, let's talk about, as long as we're on the subject of criminalization of pregnant women, let's talk about pregnant women who are incarcerated and how they are treated and the birthing process, because I know this is an issue that you are working very hard to reform.
Yeah, and I am, and folks have been trying to really challenge this birthing while incarcerated for decades now. And I think one of the most egregious acts is the shackling of women and people while they're giving birth and while they're in labor, while they're in active labor. There's a case right now of Suwatu, who's out of Detroit, Michigan. Long story short, Suwatu ended up getting a sentence, a 2-year sentence, where she's now spending it in prison. She's about 7 months pregnant. They've been trying to get her out so she's a high-risk pregnancy. They've been trying to get her out so she can actually birth at home with her family. And we all know that if she stays inside, she will be shackled, and while she's in active labor. And I think this conversation about criminalizing pregnant people and women's bodies is incredibly important. It's a reminder of really slavery. If we think about the vestiges of slavery and people not having control of our own bodies, especially Black women. And I think this is a larger conversation about how we understand the state's relationship to pregnant people, the history of the state's relationship to pregnant people and pregnant women. And I'm constantly distressed about the ways in which our rights to have autonomy of our own bodies are eroding over and over again, specifically under this administration.
If I could jump in on that. Oh, sorry, Nadia.
No, it's okay. Well, if it's okay, I just wanted to say a quick case. So the MomsRising has been working with wonderful partners on the ground. And I did want to also point out that a lot of what Patrisse outlined, there have been women's groups, Black women's groups, women of color groups that have been on the ground really fighting for these issues, fighting for their communities, raising their voices and not always being heard about these issues. And there's an organization, Sister Song, which I'm sure all the panelists know. But Sister Song is a reproductive justice organization for Black women. All the leadership are Black women, and they're in North Carolina. They led a coalition to address shackling of two women who were incarcerated. And as Patrisse mentioned, they were shackled during active labor. The nurses and doctors who were attending to them, they were taken out of the place, out of their cells, and were put into a facility to give birth. But the nurses and doctors, the nurses especially, were so distressed by what they saw that they reached out to Sister Song, to saying what could they do. They couldn't believe what they saw, and from there, Sister Song really organized and spearheaded this coalition to cause a change. And so right now, because of their activism, and we are one of the groups that was part of this coalition, they made a change of that women who are in active labor in North Carolina cannot be shackled during birth, which is a win, definitely, in some ways. That needs to be there for every state, but that's really not enough. Shackling women during any point in pregnancy, postnatal, until 8 weeks, while they're breastfeeding, these are all again part of controlling a woman's body and also harming the fetus that apparently that people say they're trying to help. It really absolutely does the opposite.
Well, it's so interesting because for a government that is now taking an administrative position of forced motherhood, and by withdrawing access to contraceptives, withdrawing access to termination, basically forcing women to become mothers, and yet, apropos of the horrendous stories we are now hearing that's happening at the border, there is very little post-delivery concern about the mothers and their children. You want to talk about some of these issues?
Well, I was going to say, Patrisse mentioned that there's a long history at play here. And I think one of the things that's important to note is that none of these systems actually came about because, some smart people sat around in a room and said, what would be really good for pregnant people? What would be really good for moms and babies and new families? The healthcare system that we have today wasn't built that way, and the criminal justice system that we have today wasn't built that way, and the child welfare system we have wasn't built that way, and certainly the immigration system that we have wasn't built that way. So what we have is we have systems at play that weren't built with the intention even of being good for pregnant people or women and babies or new families. They were built for other purposes, sometimes economic purposes, often economic purposes or other national purposes, and they're having effects on communities in very specific ways. And on the one hand, we have the benefit of incredible data that indicates the nature of the problem we have. We have a problem that is racially disparate. We have systems that are operating on bodies because of race in suspect ways. And we have a healthcare system that is failing, that is especially failing pregnant folks and new families. And we have a criminal justice system that is, interestingly, benefiting private prisons and private jails at the expense of more and more people who are being incarcerated. The rates of incarceration of women has increased exponentially in the past 15, 20 years, surpassing the growth in the rate of incarcerated men. And that has direct impacts then on generations.
And now we also have an immigration system that is having a detrimental impact on mothers and children, parents and children. And we also have economic disparity that is playing havoc with the sustainability of family relationships. So let's talk about the intersectionality of all of this. And first, let's try to make listeners aware of what are the very key issues that we need to address. What are the key problems if we can enumerate them, and then we can talk about perhaps what actions we can take.
I'm not sure this is where you want to go, but as I was thinking about those 2,000 kiddos who have been removed from their families at the border, that's going to have a physiologic impact. We know that stress and trauma changes our physiology, releases stress hormones that can be toxic to our bodies. And that, I think, is a through line on all of these points. When somebody's being coerced during childbirth, that releases toxic stress hormones. In 2015, there was a great report issued that really describes the hormones at play in the physiology of birth and articulates what can happen when there are toxic stress hormones. Certainly having an incarcerated parent is going to have a physiologic impact. And what we're coming to understand is these physiologic impacts can even have generational consequences. That when you have a parent who faced that kind of stress and trauma, it impacts their genes and potentially your genes. So certainly the response to the border right now, those 2,000 children, that's going to impact multiple generations. And it's not good for public health. I mean, at the very least, we know that it has negative health consequences, long-term, chronic disease.
Well, certainly we know it's a human rights crisis. And only this morning, the head of the American Pediatric Association came out and stated exactly what you just said, that this is a physiological, long-term public health issue because of the toxic stress. Indra, let's talk a little bit about the fact, what key issues MomsRising addresses in terms of family well-being, not just the mother and the woman, but in terms of the overall mother-child relationship, the sustainability of families, the safety of children. I mean, that's all part of the reproductive justice definition, that if you have a right to decide not to have children, but if you do decide to have children, then you have the right to raise those children in an economically viable situation and certainly a safe environment.
I think one of the key issues along these lines is the child welfare system. It impacts thousands and tens of thousands of families. And again, it's a system that wasn't really built with consideration towards what's going to be the best for keeping families intact, what's going to be the best for taking care of families. In fact, it's not dissimilar to this idea of personhood, that maybe we could rescue this fetus from their condition of gestating. There's an idea that, the state could rescue children that are at risk of neglect or abuse. And what we've found is that system hasn't worked. It's failed those kids. And I think it's a critical civil rights issue, a critical human rights issue in the United States that really does intersect with all these other ones. Sorry, Nadia.
Right.
And I mean, as we work on all this, what is happening now, all these policies are a concerted attack on families. Period, on families, on women, on children. But when we look at it in a greater concept, these policies didn't just start in after the elections of 2016. Okay, these policies didn't come out of a vacuum. The systems in place have been attacking women and families for generations, especially for women of color. The statistic of Black women dying at 4 times the rate of white women, due to birth, that statistic is it's been unchanged since 1915. That is not a statistic that is here because of the Trump administration. This is something that has been there. And yes, policies that are happening. You're talking about intersectionality. I'm talking about racism in healthcare and health access, but that doesn't have a political party. That's been there since the beginning of the United States being established the way it was established. And as Patrisse mentioned, how Black women's bodies were seen from that time to now. And when we talk about what's been happening on the borders, there was family separation before, but it is being revved up. It's being it's gotten worse. And we're also seeing, a child was taken away from his mother while she was breastfeeding him. An undocumented mother was breastfeeding her child, and the child was taken away. Parents are being detained while visiting their children, while taking their children in for emergencies in the hospital, while their kids are sick, while their kids have cancer. And one of the things that we're fearing, and you don't have the data yet, but we'll hopefully will. It's very sad data that there's a chilling effect for undocumented women seeking prenatal care, seeking births in hospitals because they're afraid of being detained while birthing. So, all these intersectional issues, I want to definitely make sure to point out that these are not things that only started in 2016. These have been systemic issues that are very deeply rooted in the history of our country, in the current systems of our country, and the policies that are happening now, I do think are making things worse and pushing the paradigm backwards instead of forward. But this is not new also.
No, and as much as I respect the American Academy of Pediatrics for coming out today about the separation of families at the border, the American Academy of Pediatrics has fallen short when it comes to recognizing the benefit of things like breastfeeding. So I think right now we can't expect those kinds of professional associations and the institutions that we want to see leading, we can't expect them to lead. We have to really, like MomsRising does so well, we have to build power from the ground up. And we have to amongst ourselves remember what we know is good for families. And we have to lead by example, and we have to lead from the ground up. We have to push those institutions to, come down with good statements, but we can't expect them to lead.
Well, let's talk a bit, Patrisse, let's talk about what we can do, what people can do. I mean, we're aware of all these issues. How can they change? It's one thing to have grassroots organizations, but, we don't see the kind of mobilizing. Certainly we have seen Black Lives Matter in the streets, but we haven't seen the kind of mobilization on a massive level as we saw over issues like the Vietnam War, over civil rights, over women's rights, initially back in, the New Age feminist movement of the 60s and early 70s. How do we get action? How do we mobilize people? The organizations exist, but how do you get people beyond reading your blogs, beyond, going to your websites? How do people actually make change happen?
Well, I mean, there's a few ways. Part of the existence of Black Lives Matter and its growth has everything to do with BLM being a part of a long legacy of Black liberation movements. And so I think this conversation around how do we truly see a mass movement for maternal justice has everything to do with what it takes to organize. It takes, sometimes decades, sometimes centuries to get people to get something to be massified. And I think there's something really important about naming that when we're talking about Black women, it's people don't show up for Black women. People don't show up in large numbers for Black women. And so part of what's happening is it's mostly Black women showing up for Black women when it comes to these issues of maternal justice. But I do think that doesn't stop these groups, our groups, from staying the course. And so number one, and building out a mass movement is organizing, talking about it, educating people. And even if, 5 people show up to an event you plan, still having that conversation. The issues of maternal mortality and morbidity, I think, I bring up Serena Williams again because what she highlighted both in what happened to her, but also in her book, really shared. It's the first time I think in history where it was on a large public scale, this conversation of maternal mortality and morbidity for Black women. So I think we need to just continue to organize around it. And two, I think we need to be challenging our hospitals. I think we need to be challenging the culture that we live in, to really look at, we haven't talked about midwifery yet on this chat, but midwifery saves lives. And having, you know, the Black midwives that I had, they really, and they really came through and supported me in the ways that the hospital could not. And so we should be looking at what it would take to establish full midwifery care in this country. And there's also legislation, federal legislation, like the Preventing Maternal Deaths Act and the Maternal Health Accountability Act, that people can follow and look at. And these are both federal bills trying to improve maternal mortality in this country. And we have a long ways to go. I think in some ways this issue has been an issue for a long time, but it's just gaining traction. And I've been an organizer for 18 years, so I understand that, you know, it's baby steps. And then hopefully one day in my lifetime, I will see people taking to the streets and ensuring that Black women in particular are able to birth in a way that is with dignity and our full health.
I think it's important to point out, to add to what you just said, that there are two bills, one in Congress, one in the House, and one before the Senate on maternal mortality, and that people should contact their representatives, their senators, to support these acts. And what we will do is we will post that information on our website and in our Facebooks, but people certainly could refer to your organizational sites for this information as well. I think it is important to discuss that historically, it was always, until the beginning of the 20th century, it was midwives, particularly Black midwives, who were responsible for birthing, until the Medical Association turned birthing into a medical issue. And in many cases, you know, there were and continue to be attempts to ban midwifery, to limit doulas. Can we talk a little bit about that?
Well, a tangible issue is right now in California, the Medical Society is actually bringing a bill to limit access to midwives, to limit the scope of nurse midwives in California. So I'll share a link so folks can respond to that. And there are still states where certified professional midwives are not legally licensed or registered to practice. And in many states, certified nurse midwives can't practice to the full scope of their credential. So there's a lot of work to be done across the country in advocating for laws that will make access to midwifery better.
And and also another aspect of that is the racial disparity in midwives right now. I mean, as you mentioned, in the past, actually, there are many Black midwives, and in the South, but in particular, white people, even like white babies, were birthed by Black midwives, and they were really seen as the experts. There were Black midwives who the UN took them, and I think in the 50s, like, created a documentary that was used all over the world to inform other countries through Black midwives before it was really criminalized and diminished in a very concerted way. And now when you look at nurse midwives, I believe Patrisse, you have the exact number. I believe less than 4%, or maybe even less than that, of nurse midwives are Black women. And to think that in the beginning of the century, there were so many, like even maybe the majority were Black midwives, and now less than 4% are. And also getting the support for Black women who want to be birth workers, who want to get a midwifery license. These are not cheap things to get. These cost money, and it's often not accessible to everybody who wants to access it. So what you're seeing now are rich white women, white women getting midwives, and that being very in vogue, and the Black women in our communities are not having the access to something that was very natural and was often created, a space that was created by them for them, that we're seeing not be supported now.
Well, the other inconsistency, of course, that affects the issue and people's awareness involves C-sections as well. That I've had a number of people say to me, well, you know, a lot of wealthy white women make appointments to have C-sections because they don't want to go through labor and they want to know exactly the due date. And that fights what we're trying to do in terms of showing that there's an excess of C-sections in this country and the potential dangers that accompany C-sections. So you're right. I mean, on one hand, the necessities are counteracted by some of the trendy, voguish behaviors. What I'd like to do, though, is talk about how this is not, the issues we are discussing should not be polarized, should not fall on either side of the aisle or either side of the argument about reproductive rights. That people tend to think of reproductive rights only in terms of the A word. And we tend to focus on choice, and it divides the camp between choice and pro-lifers. What I'd like to ask all of you is, how do we bridge this? How do we make even opponents of abortion recognize that the issues are far greater and that the intrusion of government and courts and even some of the medical establishment is creating a situation that is jeopardizing women's health and that bridges these polarizations, that women who may want to give birth at home and have natural childbirth and may be opposed to abortion are also at risk. How do we begin to have a dialogue and cross the bridges so that we can get an entire community involved in making changes?
Well, the Preventing Maternal Death Act was actually is co-sponsored by a Republican woman, Representative Jamie Butler Herrera out of Washington. So when we look at least these federal pieces of legislation, and so much of the focus today is how federally no one's coming together on anything, but actually these are the Preventing Maternal Deaths Act and the Maternal Death Accountability Act, the two sister acts in Congress, do have a lot of bipartisan support, and people who are on opposite spectrums on other issues, who would never agree on other issues, actually do seem to agree that the maternal death rates in this country and the maternal morbidity rates in this country are unacceptable. And I think my feeling about this is what really makes a difference are stories. It's really sharing our stories. Everybody comes from a mom, but a lot of people in Congress, they have children. Maybe their loved one, their wife went through childbirth. In New Jersey, there's legislation here. You'll hear people from all over from different parts of the aisle speaking about something that happened to their own wife, how they lost their own wife to birth. So I think sharing our stories, raising our voices, really telling these personal individual stories that anybody can connect to and many people have experienced, goes beyond any kind of political leaning or realm or argument. It's about health. It's about being heard. It's about birth, which is it's such an integral part of existing. It's such an integral part of health. The number one reason women go to all women, the number one reason for hospitalization in this country is because of childbirth. So that is a very common thing, and we can connect on that. But we can only connect on it if we have our stories. MomsRising had a birth story collection that we still have. So if anybody listening wants to share their birth story and raise their voice, they can go to our website, our blog, and submit their story. We have about 250 stories. And let me tell you, those stories make a difference, and there needs to be even more spaces for that.
Patrisse, let me ask you, in terms of criminal justice abuse, one would think that crosses over any kind of polarization as well. How can people respond? How can people call attention to what is happening to incarcerated pregnant women?
I mean, I think folks should follow the story of Sawatu Ram, who is out of Detroit. She's a perfect example of how challenging it is to fight for women who are incarcerated, Black women in particular. I think people should be fighting local jail plans. Many of us in LA County have been trying to fight a $3.5 billion jail plan. In that jail plan, they're also trying to build a women's prison. And we know that many of the women that are going to be in those prisons are going to be mothers. And so we have to be on the offense. And I think it's important that this, the Maternal Health Act has bipartisan support. And I want to remind us that we need to be thinking about exactly what Nadia, really started this chat off saying is what happens to women and people's health before they get pregnant. And we need to be fighting for a healthcare system that is centering the dignity of Black people and Black women who will end up pregnant and in their care. I think when it comes to criminal justice reform, we have to be courageous enough to challenge the impact the war on drugs has on our communities and has on pregnant people. I think it's incredibly important, the stories of women who are constantly talking about being tested positive or having a history of drug abuse, and then unfortunately the cops or social workers being called on them and their children being taken away from them. And so there's deep intersections around the criminal justice system and its impacts on people who end up pregnant and women who end up pregnant. And we have to see the through lines, and we have to see the intersections and fight from that place.
Well, exactly. I mean, the intersection in terms of public health crises and civil and humanitarian rights. We are getting toward the end of our allotted time here, so why don't I ask each of you to give your closing thoughts on the issue and sum up what you think people should be calling attention to and acting on.
I'm going to start because I think I'm going to have a cough attack soon. But I do want to talk about the use of C-sections. We didn't get to really touch on that in this chat either. And we know that C-sections, in the US in particular, are often forced. People feel coerced into C-sections. C-sections are used, abused in often cases. And so MomsRising, we're actually starting a story collection of called the C-Section Chronicles, where people and women get to tell their stories. And already there have been some of just hard and challenging and disturbing stories about people and women who are forced to have C-sections, and that C-sections that went wrong, and some C-sections that led to women's death. And I think it's an important part of the healthcare conversation when we're talking about birthing. I'm grateful for the ability to have a C-section. I literally needed one, but there's so many people and women that don't and end up getting them and end up being forced to have them at continuous births. And so I think this conversation about C-sections and really having this open dialogue around it, I think is incredibly important in this moment.
And that involves dealing with the medical community, making them aware of what's happening, certainly letting every woman know what her birthing rights are. So, Indra, would you like to pick up on that?
The thing that I've been telling folks for years who get interested in this subject is to follow what you are passionate about. Because there's so much work to be done in this area that there's no sense in limiting yourself or trying to do something somebody thinks you ought to do. Tell your story, talk to people you know, and follow your passion. And I really truly believe, because we need people power right now, we need that organizing that Patrisse was talking about. It's going to take people being fueled by what they care about to get the job done. I also just would add that as we try to tackle these problems in the maternal healthcare system and the criminal justice system, it's important to keep an eye both on getting the reforms we want in those substantive areas and also making sure that we disrupt and dismantle patterns of white supremacy and racism, and not reinscribe those into solutions on these issues. Because if we do that, we're just going to have another problem to fix later.
Nadia.
So I think I want to address some of the racial disparities, which was, a big part of the conversation, as it should be, is listening to Black women. Like, what does that really look like? And I really love what Patrisse said, which is centering the dignity of Black women in the work. Going to lots of different maternal mortality, morbidity events and things like that, you learn a lot, you connect with lots of people. But the one message that's really, to me, the most direct message is that the maternal death rate in this country, which is right now the worst of any developed country, the United States has the worst death rate, it will not go down, it will not get better unless the disparity that Black women are experiencing is addressed. Literally, it just won't change unless that disparity is absolutely a key part of the solutions of addressing this issue. So if we can all rise together by doing that, and so part of that is sharing stories. I really encourage everybody to share their stories, but I also encourage people, medical practitioners. There's a lot of ingrained racism, not just in the systems, but even in our providers, even in ourselves. So one of the things we heard over and over again when we got stories from women of color is that they absolutely were not listened to. You heard that in Patrisse's story. They weren't listened to, they weren't informed, they weren't respected. Their dignity was not centered whatsoever. So centering the dignity of Black women, listening to Black women, sharing our stories, definitely calling elected officials and saying that this is something that we care about is important. But there are also things in your state. There's legislation happening in lots of states around the country. And so that's great. That's happening as well. And anybody listening, become a MomsRising member. This is not a plug for MomsRising, but it is a plug to be engaged with the maternal justice work. It's really revving up. The policy work is revving up. We're creating spaces. We have a space for storytelling. So if this is something you are interested in, MomsRising is a space to be active from that grassroots level all the way to making an impact on policy change.
Thank you. I'd like to thank all of our panelists for their contribution for this informative and enlightening discussion. Our mission with Birthright, a War Story, has been to turn a movie into a movement, to turn the viewing into action. And that's why we are conducting these kind of panel discussions. The motive for making the film was a wake-up call and a call to action. And so I also would like to end by saying that your involvement in organizations, your involvement in the movement are essential. However, at the moment, we also are committed to making people aware that with midterm elections coming up, getting candidates into office who will support women's health, who will support women's rights, who will support humanitarian rights. It's critical. So please mobilize to get out the vote, get everybody you know to get out the vote, support candidates who care about supporting women's issues and healthcare issues for women and children. Thank you all again. And please go to our website, birthrightfilm.com. We will have information about the organizations, about MomsRising, about Elephant Circle, about Black Lives Matter, about LA prison reform, and where you might be able to turn for support. Thank you again.
Thank you so much for having this discussion.
Thank you.
Thank you.